Good afternoon, my people. It's my hope that you have had a very good and wonderful day. Yesterday we started a brand new topic about diarrhea after finishing another very important topic that people had been requesting about vomiting. I know each one of you can define what vomiting is, the signs, the causes, and the remedies you can apply at home without using chemicals, because we discussed all of those. Yesterday we talked about we defined diarrhea, the two types of diarrhea, which is chronic and acute types of diarrhea. Today we will continue by talking about the causes. And before we continue, guys, as I always start by appreciating you people for making me part and parcel of your family. It's all because of you that we are where we are at the moment. I never knew whether by the end of the year we will be at 10,000 subscribers, and we are still forging on. So let's continue keeping the support on. Let's hold our hands together and make this channel a success, because it will benefit the whole community as a whole. For those who have not subscribed, let's continue subscribing, sharing, and commenting on our videos. Causes of diarrhea. Because if somebody is having diarrhea, it must be a cause. It must have a cause. You can't just diarrhea without a cause. So, several conditions or circumstances can lead to diarrhea. Several conditions or circumstances can lead to diarrhea and include the following. Several conditions or circumstances can lead to diarrhea and include the following. Number one, viral infection, including rotavirus, norovirus, adenovirus, and also viral gastroenteritis. Those are just but examples, because I think we discussed about rotavirus, norovirus, and the viral gastroenteritis in depth when we were discussing about food poisoning. The second cause of diarrhea can be bacterial infections, including salmonella, of which we also discussed about salmonella in depth, and also what we call E. coli. Those are the two most common types of bacteria which can cause diarrhea and can also cause food poisoning. Remember, diarrhea is among the 10 common signs and symptoms of food poisoning. For those who are following my topic on food poisoning can tell this. Number 3, we have parasitic infections. And if you have been careful, if you look at the causes of diarrhea, they rhyme with the causes of food poisoning. Because in food poisoning causes we have virus, bacteria, and parasites. In the causes of diarrhea we have viral infections, bacterial infections, parasitic infections. The next cause we have intestinal diseases or diseases of the intestines. Number 5, we have a food intolerance. A food intolerance such as lactulose intolerance. That means your body or your stomach can't accommodate or tolerate that kind of food. So this might lead you to diarrhea. Number 6, we have an adverse reaction to a medication. You may take some medication, and the reaction can make you diarrhea. Number 7, we have gallbladder or stomach surgery. Gallbladder or stomach surgery. This can also lead to diarrhea. A point to note: rotavirus is the most common cause of diarrhea globally. That means in the whole world, the most notorious cause of diarrhea is rotavirus. Most diarrhea is as a result of contaminated water supplies and sanitation. And this is very obvious, even here in Kenya. Most of the contamination comes from the water we use, which is contaminated, and also poor sanitation or poor hygienic conditions. Chronic diarrhea may be a symptom. Chronic diarrhea, we said it can occur for days or months. So chronic diarrhea, or the diarrhea that is recurring after a while, which is on and off, may be a symptom of a more severe condition such as irritable bowel syndrome or inflammatory bowel disease, whereas frequent and severe diarrhea could be a sign of intestinal disease or a functional bowel disorder. Let me repeat this one, very important. Chronic diarrhea, the diarrhea that is on and off. Chronic diarrhea may be a symptom of a more severe condition, such as irritable bowel syndrome or inflammatory bowel disease, whereas frequent and severe diarrhea could be a sign of intestinal disease or a functional bowel disorder. Symptoms of diarrhea. The main symptoms of diarrhea are frequent, loose, watery, and pressing urge to have a bowel motion or a bowel movement. Symptoms of diarrhea, or the main symptoms of diarrhea, include frequently loose, watery, and pressing urge to have a bowel motion or a bowel movement. A point to note: there are many symptoms of diarrhea you may experience. One of these or any combination of all of them. So among the symptoms that I'm going to name, alongside the frequent loose, watery, and pressing urge to have a bowel motion, so you may have one of these signs or a combination of two or more of these signs. So there are many symptoms of diarrhea. You may experience one of these or any combination of all of them. These symptoms depend on the cause. The symptoms depend on the cause and include the following. Number 1, nausea. We talked about nausea when we were discussing about vomiting. Abdominal pain, abdominal cramping, bloating, dehydration, frequent urge to evacuate bowels, large volume of stools. Nausea, abdominal pains, abdominal cramping, bloating or constipation, dehydration, frequent urge to evacuate bowels, and large volume of stools. This marks the end of our first video today. Let's continue keeping the support on and make this channel a success. Let's meet in the next video in a few minutes.